Jeff, and welcome to another live stream. We have the power team here today. We've got Ari from our partner chapter and Jill, the producer, who will be navigating the questions for you and also posting some different links in the chat box, because invariably we start talking about things and we just assume that you can remember them, and that's a bad assumption. We've had several emails that have come through in the last few weeks that say just put something somewhere. So Jill is ready and waiting to put the URLs and the email addresses to all the stuff we talk about today. Before we get going, just a couple of housekeeping items. Many of the questions we cover here are nuanced. We'll do our best to answer them, but our responses are meant to be directional, not exact. Your situation may require more details than we can cover on a live stream, so therefore this live stream is for educational purposes only. We haven't had the chance to speak with you one-on-one, so please treat this information as general guidance, not advice to act on. For any specific advice for your specific situation, make sure you talk to a qualified professional. Speaking of qualified professionals, if you have questions about Medicare, give our trusted partner chapter a call at 440-703-1224. Their phone number is in the lower left-hand corner to see if they can help you with your Medicare questions. All right. I think that just about covers the prepared remarks. Jill, why don't we jump into the questions?
Great. All right. Well, so welcome back, Ari. We have a bunch of Medicare questions for you tonight because we haven't seen you for a little bit. So we're glad you are here. So why don't we start out with a Medicare question to start our evening off? I'm moving to our Medicare section. All right. So Ari, Tim is asking, if I turn 65 mid-year and have a high income year that triggers IRMAA, do I pay higher Medicare premiums for the full year or only the months I'm enrolled?
You'll only owe for the months that you're enrolled. Let me take a step back. IRMAA stands for the Income Related Monthly Adjustment Amount. It's a high earner tax. It applies to you if based on your tax return from 2 years ago. So not the tax return that we're filing tomorrow, but the tax return that you filed 2 years ago. So for this year, the government's looking at your 2024 tax return. If you're a solo filer, IRMAA would apply if you earned more than $109,000 modified adjusted gross, which includes cap gains. Or if you're a joint filer, and you and your spouse earned more than $218,000 modified adjusted gross, and it's graduated. So the more that you're above those threshold amounts, the more that you owe. And once you earn $750,000 or more, congratulations, you're in the top bracket. Now, if you're starting Medicare this year and you're a high earner, you're only going to owe for the months that you were on Medicare. So if you're starting Medicare in July, you'll just owe for July through the end of the year. And then for 2027, the government is going to base it on your 2025 return. A question that we always get, I know it's going to come up. What if you've had a change in life circumstances? Then we'd be more than happy to help you appeal. It's something that we do every day, dozens of times per day. You just need one of the 8 life-changing events: work stoppage, work reduction, divorce is the third most common. That affords you the opportunity to appeal your IRMAA. And if you have any questions about it, it's a real short form. It's called Form 44, SSA Form 44. It's a 3-page form. You submit it to the government, and then they get back to you in 4 to 6 weeks as to whether your appeal has been successful.
All right, great. And Ari, I'm seeing on your name, author of It's Not That Complicated. And so for whoever is new to this channel, Ari has put out a book on Medicare that is a great, great resource. It's called It's Not That Complicated. The new version is out. And by being on this show, I will put into the chat box in just a minute the link. In order to get it, you can just use that link and put Ari's book into the email that you send us, and we will send that out to you complimentary. So definitely take advantage of that resource. Also, I didn't mention before, please do put your questions into the chat box. We do take your questions live. We also have questions, many questions that were emailed in. So we'll be taking those questions until we start to see more questions coming into the chat box. So Jeff, you're up with Social Security. Rich and Pete are asking, can my wife claim Social Security at 62 and later switch to a higher spousal benefit when I claim? And would her early filing penalty carry over? Also, what happens to her benefit if I pass away?
All right. So the question has two parts. Part one is, can your wife claim her own benefit early and then switch to the spousal benefit, which is presumably higher? The answer is she can. The issue is two things. One, she can't claim the spousal benefit until you file for your own benefit. That's a prerequisite to claiming the spousal benefit. And the spousal benefit, if she claims early, a portion of the spousal benefit is fixed at the point at which she claimed. So the example I always use is if her benefit was $1,000 at full retirement age and her spousal benefit was $1,500 at full retirement age, but she claimed her benefit at age 62, she gets 70% of her benefit. That's $700. And so that additional $300 that she would have gotten for waiting on her own benefit comes right off of the spousal benefit. The maximum she could get in that example is $1,200. And so it's important that you note that the SSA doesn't allow you to claim one benefit and then use it until it's time to claim the other benefit. They do have policies around that. The other point to make here is that there's a concept called dual entitlement. If you've already filed for your own Social Security and your wife claims that her own benefit, but she also qualifies for the spousal benefit and that benefit's higher, she's going to get the spousal benefit even if she files for her own benefit. It's called dual entitlement. When you have a dual entitlement, the SSA gives you the higher of the two benefits. Now, the other question, what happens to her benefit if you pass away? The spousal benefit is one benefit. The survivor benefit is a completely different benefit. They both start with S. They both go to the same person, but they aren't linked. And what I mean by that is she will have the opportunity to claim the higher of the two. And a strategy that some people use is, in this instance, they will take the survivor benefit and let their own benefit grow until age 70 if they're similar in size. And so there is no penalty for claiming the spousal benefit and later switching to the survivor benefit. There's no penalty on the survivor benefit. You can switch from one to the other, and there's no issue, unlike the first point where she has her own benefit and she's comparing that to the spousal benefit.
All right, Ari, I believe this question is for you from T. Carlier. If I lose my qualified insurance unexpectedly and have been contributing to my HSA right up until now, is there any way to avoid paying a penalty? Can I request a refund of excess contributions?
So I think this question is for someone who started Medicare already, and at the same time, they've been making contributions to a health savings account. You want to stop your HSA contributions before you start Medicare. So if you're turning 65 next month, you just want to stop them by the end of this month. If you're already 65 and you're planning to start Medicare this year or early next year, stop those contributions now. Because if you're past 65, the government is actually going to backdate your Medicare Part A by 6 months. And so that would create a timing issue related to HSA contributions that you make for this year. Now, what happens if you say, oops, I didn't know about this rule. I just learned a bit about it. What can I do? Let's see how we can help you. The easiest thing to do would be to request a return of the excess contribution. Some employers are willing to work with you on it. Others, it might be more challenging. So it gets into the nitty-gritty here.
All right, a Social Security question for Jeff from Patricia. Will potential Social Security cuts affect current retirees or only future recipients? And should that impact when I choose to claim?
This is one of those questions where you're given two potential answers, but there are actually three. I don't know if you had that when you were a kid and your mom would say, "Did you do this or did you do that?" And both of them were not good answers. The third answer is actually the right answer here. So the assumption is that potential Social Security cuts are going to happen, and so I think that's unlikely. I've said this many times in the past. I can't guarantee it, of course, because I'm not the government. But imagine what happens if 57 million Social Security recipients all of a sudden get their benefits cut by 30%, and now they're calling up their kids and saying, "I'm moving home." And what's going to happen to the politicians when 57 million people vote them out of office the following year? So I think it's unlikely that it's going to happen. But if it did happen, the way that the language exists today is it would be across all recipients. And so whether you're receiving Social Security, whether you've just received Social Security or you've been on Social Security for many years, the language currently reads that everybody's affected the same way. I think realistically, what will happen is that we'll get to the 11th hour like we did in 1983. We were 3 months away from having a trust fund that had no funds. We'll get to the 11th hour, and then the politicians will come up with something. And it will be probably some combination of raising the tax on Social Security modestly. They raised it 0.8% in 1983, and then the employer match 0.8%, and extending the full retirement age up. Now, if the future is anything like the past, they're going to wait a period of time before it affects the second part, which is the extension of full retirement age to say age 68 instead of 67. They wouldn't do it immediately because you have a lot of people that are converging on 67. The way they did it in 1983 is they said, yes, we're going to raise it from 65 to 67, but we're not even going to start that process for 20 years. And so in that instance, anybody that was retiring at age 65 between 1983 and basically 2000 was still able to retire and get full retirement age benefits at age 65.
Jill, can I take a question from the chat?
Yeah, absolutely.
So Jeff asks, Ari, I went on the chapter website to look for a Medicare plan for me and my wife. The big disclaimer scared me off as it seemed like a large data collection website. True. No, not true. Not collecting your data. Instead, this is a Medicare required disclaimer. So any reputable advisory that you work with is going to have a similar sounding disclaimer because that's what's required by the government.
Okay. And Fishing with Vance has a Medicare question as well in the chat box. Does the sale of your home count towards IRMAA calculation?
So there's an exclusion. If you're a solo filer, there's a $250,000 exclusion on the gains from the sale of your primary residence. If you're a joint filer, there's a $500,000 exclusion. And Jeff, that hasn't been increased in a while, has it?
No, it hasn't. And the rules are very relaxed. You only have to have owned the home for 2 of the last 5 years. And so assuming that you're not flipping, it's the anti-flipping rule, but basically assuming you're not buying a home and flipping it and trying to game the system, get $500,000 and move on. But no, that has been there several years now, and it's probably due to increase at some point.
All right, Ari, do you update your book every year?
Yes, and actually, if you email Jeff and Jill, they will provide the latest edition of the book. I just updated it last month for 2026. It's going to have all the new information for this year.
All right, great. And guys, I did put that into the chat box. And for anyone that may have just logged on, I will put it back into the chat box again. so that you can have that book sent to you complimentary. You just email in and type Ari's book, and the book will be sent out to you. It may take a little bit because there's so many requests, but you will definitely receive it. All right,
All
Jeff.
right. All right, I made a comment last week where you weren't on, but I said I think we've shipped more copies of Ari's book out than Amazon.com in 2026. The number has been ridiculous. It's taken weeks and weeks to get some. The list is hundreds and hundreds of people, which is great. But gang, just email livestream@holyschmidt.com and put Ari in the description, and we'll know what to do.
All right, Jeff, here's a Social Security question. Is it worth withdrawing from Sarah? Is it worth withdrawing from my 401k so I can delay Social Security until age 70?
Sometimes it depends. There's no holistic analysis of this because a lot of it depends on how you spend your money, what's happening in the markets. If we are in a bull market, if we're in a bear market, if you're worried about sequence of return risk, there's so many things that go into the answer to this question, but people do it successfully. And what you wouldn't want to have happen though, as an example, and this isn't the only example, imagine it's 2008 and your portfolio drops by 40%. And you decide that that's the time to start selling your assets in your 401k to allow Social Security to continue to grow. There are some points in time where it's just super obvious that that's not the right move. The best answer I can give you here is sometimes, but talk to a financial planner about your specific situation because they can give you a much better read on that. And if you're interested in a financial planner, just fire an email to us at livestream@holyschmidt.com. We have a panel of them that we recommend. We don't receive any fees from the financial planners, but we do recommend them to folks from time to time. They can work with you.
All right, great. So Josh Ohana 650 has a Medicare question for you, Ari. If I start Medicare Part B, but then go on my wife's insurance, can I put my Part B on hold?
Absolutely. It's very easy to terminate your Part B. It's a one-page form. It's form CMS 1763. You just put that you want to cancel your Part B. And then when you're ready to come off your spouse's work provided coverage, that's when you would reactivate your Part B. No reason to double pay for insurance. Wouldn't want to see that happen.
No. All right. Dan Cohn is asking you, Jeff, Social Security question. I've received conflicting advice on this. I will be FRA in August. Am I penalized for any of the 7 months of income, $77,000 I received from January to July?
Well, if you haven't filed for Social Security yet, no. And once you file for Social Security at full retirement age, you're not penalized either. Where you potentially are facing challenges if you're drawing Social Security and working at the same time, which is what I think you're asking, and you haven't reached full retirement age, there are thresholds that you have to stay under, and those thresholds are pretty high when you're in your full retirement age year. But once you reach full retirement age, there are no penalties. You can earn as much as you want. And so the answer is, if I understand the question you're asking, if you file for Social Security at full retirement age and then continue to work, there will be no penalties. That's correct.
All right, Ari, Chris has emailed in a question asking, if I retire overseas, do I still need to enroll in Medicare, and can international health insurance replace it?
For expats who are planning to reside abroad and not intending to return to the US, then it wouldn't make a lot of sense to pay for Medicare unless there's some operation that you may have down the road that you would come back to the US for. Alternatively, if you're splitting time, let's say between the US and Mexico, then even though you're going to be an expat in Mexico, it would certainly make sense to pay for Part B. So it just depends on your situation. And if you do have Part B, then it might make sense to look at additional plans that would provide coverage when you come back to the US. So it really depends on your situation. Some other countries' health insurance programs are creditable for the purpose of delaying Medicare, others aren't. It depends where you're intending to reside.
All right. So Rob Sabata is asking, why has Social Security not indexed their guidelines / calculations for things like provisional income, etc.?
It's a question that has stumped a lot of people. And the reason it has stumped a lot of people is because there are some things that are indexed. The calculation itself is indexed. The calculation is based on how much you earn, your average index monthly earnings, and that is fed into a formula, and that formula increases the payment every year. But provisional income and related thresholds are not indexed, which means that more and more people are paying tax on their Social Security today versus back in 1983 when provisional income levels were put in. Originally, back then, less than 50%, in fact, less than 90% of people, I believe was the actual number, would actually pay tax on Social Security. And then it went way up, and it's come back a bit with the new 65 plus deduction. But it's a good question. I wish I had a better answer than somebody somewhere thought it would be a good idea to lock in a low provisional income rate and that way, or low tax on Social Security rate, because that would mean that more people would pay tax on Social Security. That's the only reason I can think of that it's there.
All right. For everyone that's wanting Ari's book, and there's a bunch of people that would like that, are putting into the chat box, and you're typing in Ari's book into the chat box. You need to send an email to livestream@holyschmidt.com and then type in Ari's book. And that way we can send it out to you. So yeah, so you won't want to type Ari's book in here because we don't have any way to send it to you from here. And we don't want any personal information going into the chat box. Okay, so
I wish you could just drag and drop it into the chat.
That would be great.
That would be awesome. Great. All right, Kevin Norris has a Medicare question for you, Ari. I turned 65 August 17th this year. When is the earliest I can sign up for Medicare Part A? When is the latest? And when should I? I have VA benefits and plan on taking my Social Security in March 2027.
If you're turning 65 in August, then your window to sign up begins in a little over 2 weeks. It opens in May. As long as you sign up for Medicare in May, June, or July, your Medicare will start August 1st. Now, if you wanted to wait, you could do that, but the question would be, do you get all your benefits through the VA? Are you 100% VA connected? Many ex-service members want the flexibility of going to the VA and going to private doctors when they choose. And the vast majority of people who use the VA still sign up for Medicare. So that's probably what I would suggest in your case, unless you're comfortable being 100% VA connected for the long haul. If you wait to sign up, then this is where we get into the world of penalties. And the way to avoid it is just by knowing when your initial enrollment period begins. With an August birthday, your initial enrollment period begins in May. There is one wrinkle here. The question references Medicare Part A. You'd want to sign up for A and B. If you're retired, if you've been on Obamacare, if you've been on COBRA, the only exception to delay starting Medicare is for someone who works for an employer with 20 or more employees, or your spouse does. You have to be actively working. So if that doesn't apply to you, then I would certainly recommend signing up for Part A and B when May rolls around. And it takes less than 5 minutes to sign up for Medicare through your online Social Security account. It's fast, safe, and secure.
All right, Jeff, this is questionable of whether this comes on this show or is an emailed question into you later. But PHDM8EW is asking, I'm doing Roth conversion and paying the taxes using the RMDs from my stretch inherited IRA. What are the drawbacks to that strategy? Trying to minimize my RMD for when I start Social Security in 5 years.
So RMDs don't start until 73 or 75. So I don't think that, I think the question, I think you're probably asking a different question than you're using your RMDs to fund your Roth conversion. Maybe, I think what you're asking, are you asking, are they asking to avoid RMDs? They're engaging in Roth conversions now?
Trying to minimize them.
Okay, so RMDs, and we can get into this in great detail, and I mean, it's the day before tax day, so I'll definitely, I could talk at length about this. But RMDs are very difficult on people who have a lot of money. And I don't mean a lot of money to the point where they don't need it, but if they can't spend enough that they're actually required to take money out of their IRA or their 401k and pay taxes on it with nothing and not use it. You combine that, because that does two things. One, it increases your tax bracket oftentimes, and it increases your IRMAA surcharge oftentimes. And so what they do is they'll start converting their IRA early, and they'll either use some of the current benefits of the 65 plus tax deduction and other tax deductions for retirees and the current lower rates, and assume that they're going to get zero or low tax bracket, and they'll convert up till they hit the bucket, whatever bucket that they feel is appropriate for them. And it's a great strategy, because if you're going to pay taxes anyway, why not pay taxes at 0 or 12% instead of 24% when RMDs kick in? And I'm just making up the numbers, but directionally, that's the conversation. So it's a good idea, but there are so many caveats around it. What is there a different need for your money later on? Do you want to leave money for your kids? Is there some charity that you want to give to, so forth and so on? And so it's definitely a question. You're asking the right question. And I have entire videos on this particular point. In fact, if you look in our library over the last couple of weeks, I've published 2 or 3. But if you want to get in depth about your specific situation, shoot an email to livestream@holyschmidt.com, and we'll come back to you with a recommendation of a financial planner who can help.
All right, thank you for that. All right, so Connie Griffin is asking, Ari, my insurance is the primary payer ahead of hubby's Part C. When I retire, will that create a special enrollment event? He would like to switch to full Medicare with a G plan supplement.
So it sounds like what Connie's husband has is a Medicare Advantage plan. The window to adjust Medicare Advantage just ended at the end of March. So instead, unless there's a special enrollment period that pertains to your husband, for example, if you move, let's say that would create one, then the time for us to help your husband would be in the fall between October 15th to December 7th. That's when we can move your husband to a Medigap plan and also help him sign up for a standalone prescription plan. Now, as for your retirement date, you'll be able to choose a Medigap plan when you retire with no questions about your health history. And this is really important. There's only 2 types of additional coverage to cover the 20% you otherwise owe out of pocket under original Medicare. Option 1 is Medigap. This is the most comprehensive and flexible coverage. If you go this route, then all you need to do is add a standalone prescription drug plan. Option 2 is Medicare Advantage, and that's what you see advertised on television. You could pick your favorite Medicare Advantage spokesperson, Joe Namath, William Shatner, Jimmy Walker. What they're talking about is Medicare Advantage. These are managed care plans. They're subject to network restrictions, unlike original Medicare, which is networkless. And they're also subject to prior authorization, which means the insurance company gets a veto over the healthcare that you receive. And there were over 50 million prior authorization requests in 2023 alone. So this is really consequential. In 46 states, you only have a one-time window to obtain Medigap option 1 without questions about your health history. So it's something to think carefully about when you start Medicare. And Connie, I can see that you're already thinking about it, which is great.
All right. Robin Harrison has a Social Security question for you, Jeff. What do I have to do to pay back Social Security for disallowed income throughout the year so as not to be penalized? Have been working as self-employed and will continue to do so, but have not gotten Social Security notice.
Yeah, I would not wait until you get a notice, because it could be 2 or 3 years and the number could be really large. There's so many horror stories around this. People don't realize that they actually can't continue to work and claim Social Security without having to give part of it back. And so I've heard about people going out and buying a new car, and they thought, you know what, I can afford the monthly payments because I have all of this cash coming in. They'll get a new $50,000 automobile, $75,000 automobile, only to find out a year into it that they have to give money back because they're over the earned income limits. If this is your specific situation, contact the Social Security Administration immediately. And I would actually do this by phone. I wouldn't fill out any forms. I'd have a discussion with somebody, because you can have them stop or reduce the size of your Social Security payment, and they can work with you on that to determine what the right amount is. You will have to pay back what you've received, at least a portion of it. The good news is that you don't lose it, though. It just becomes part of a larger payment when you reach full retirement age. And so you may be giving it back now, but your full retirement age benefit goes up. And at full retirement age, you can work as much as you want, earn as much as you want, and there is no limit. And so between now and then, just let them know. And that way they don't continue to pay you, and then you get a big bill in 2 or 3 years.
All right. Sandra has a question for Ari that was emailed in, and she's asking, can I switch to a different company for the same Medigap plan N to get a lower premium, or am I locked into my current provider?
No, you're not. So for Medigap, you can shop your Medigap plan at any time and see if you can get a lower price. And what I really like about this question is that it recognizes that Medigap is standardized under federal law. So an insurance company's Plan G is the same as any other insurance company's Plan G. It offers the same hospital and medical benefits. Same thing with Plan N. So what the carriers are primarily competing on is price. So don't overpay for a standardized product.
Okay. Amy has a Social Security question. She's asking, can you apply for Social Security completely online? And when should you apply to receive your first check in July?
You can apply online, and most of the time it will work. And I would say 95% of the time it will work. When it won't work is if there's something that is unusual in the system. And what I mean by that is typically someone got a hold of your Social Security number and has been employed using your Social Security number. And by the way, this people almost always get really nervous when I talk about this, because they think that means that person is going to claim their Social Security. It's so unusual, so rare, because they'd end up in prison, number one. But number two, the reason they want your Social Security number is so that they can work. And actually, perversely, it actually increases the size of the pool. But if they have you working in California and working in New York for 2 different companies at the same time, when you go to apply for Social Security, that's going to get flagged. And so most of the time it's not a problem. 95% of the time it's not a problem. For a July payment, you want to actually have everything done and dusted by June, because everything is in 1 month in arrears. It means that you should apply now. and tell them that you want to start in June and your first payment will arrive in July. Conversely, if you want your Social Security to start in July and get your first payment in August, you should still apply now. You can apply up to four months in advance. There's no reason to wait.
All right, Joanna Gordon has a question for Ari. If I have healthcare benefits from the employer I retired from as part of my retirement benefits, am I subject to IRMAA?
For these retiree health plans, first, they're few and far between. So it's great that your ex-employer offers one. Some of them are quite comprehensive. For example, if you worked for one of the legacy auto manufacturers or an oil and gas company, others aren't really worth the paper that they're printed on. So it depends. And that's something that we're happy to do an apples to apples comparison for you. First, we would want to know what you're paying for that retiree health coverage. Now, what these retiree health care plans typically state is that you have to be on Medicare. You still have to start Medicare Part B. Medicare is your primary insurance, and then your supplement is through your employer's retiree plan. So yes, IRMAA would still apply to you.
Okay, and so if you want this free advice from Chapter, the phone number is on the bottom left of Jeff's screen. The number is 440-703-1224. All right, great. Joe Bush has a question for Jeff on Social Security. When I look at my Social Security from age 66 to 67, it changes every month until from 67 to 68, it stays the same. Changes at 68. Why does it not show an increase between 67 and 68?
There are so many different reasons why that could be the case. Let me give you an reassurance on this, that they don't stop measuring monthly once you turn 67 or 68. It's still calculated and increases monthly. Most people think about, when they think about Social Security, they think about taking it on their birthday, to be frank. Overwhelmingly, it's a big number. People take it on their birthday. Their 62nd birthday is the biggest of all, followed by their full retirement age, 67th birthday. But sorry, not 67th, but their full retirement age, whether it's 67 or not. But it doesn't mean that you can't get the increase every single month. It's just a calculation issue. If you look at your statement again in a couple of months, you'll probably see it fix itself. If it's a problem and you're looking at what your payment should be somewhere in between the birthdays and it still hasn't resolved itself, then it might be worth a quick call to the Social Security Administration. But if it's just because it's just showing annually for now, that's just a function of they're just not caught up yet.
All right, Sam Cohn has a Medicare question for you, Ari, regarding IRMAA. If we're married filing jointly and we don't meet the $218,000 income limit, do we need to care about an IRMAA surcharge to our Medicare cost?
Nope, you got nothing to worry about if you're below the $218,000 limit based on your 2024 tax return. There also is another question that came up about what someone who's already taking Social Security needs to do when they turn 65. And the answer is you're automatically enrolled in Medicare if you're already taking Social Security at or before age 65. So you don't even need to go online and apply for Medicare. The government will actually mail you your red, white, and blue card 3 to 4 months before your 65th birthday.
That's great to know. All right. So Rob Sabata had a thought. He says, just a thought on Ari's book. Is there a way to get a link on the Holy Schmidt website? Then everyone can just download it as desired.
Probably. I think we gotta talk to the techs on that one, but I think we can probably figure out how to do that. But in the meantime, if you like a copy of Ari's book, just email Ari, email livestream@holyschmidt.com and put Ari in the subject line.
Yes. All right, great. So Lynch Chappelli 1000 says, does Medicare Part B pay for rehab/nursing home care?
No, this is one of the biggest gaps in Medicare. So under Medicare, so picture Medicare as a three-legged stool. The first leg is hospital coverage. What happens to you when you're inpatient? The second leg is outpatient, everything outside the hospital. Visits to the doctor, specialists, lab work, x-rays, MRI, CT scans, outpatient procedures, even durable medical equipment. That's the second leg of the stool. And then the third leg of the stool is drug coverage. Now, each of these legs corresponds to a part. Hospital, Part A. Outpatient, Part B. And then finally, drug coverage, Part D. D is in drugs. What's not covered is home health care. There's very limited coverage for home health care under Medicare Part A, super limited. But if we're talking about around-the-clock care, custodial care, 24/7 care, long-term care, not covered under Medicare. So this is something to think about, long-term care coverage. And by the time you reach 65, it's oftentimes too expensive to insure for long-term care. The time to be thinking about it for those, if you're watching this and you're in your 50s, that's a great time to start thinking about long-term care. Otherwise, you may have to self-insure and pay out of pocket if you need nursing care.
Okay, and just a follow up from the last question you answered, Ari. Someone wants to know if it's automatic sign up if you already are on Social Security prior to age 65. Is that correct?
Automatic sign up, yes.
Okay.
You'll be mailed your red, white, and blue card by the government 3 to 4 months before you turn 65.
Okay, great. Darren Hibre is asking a Social Security question. My sister will start Social Security at age 62. Her ex-husband will be 60. They have been married less than 10 years and do not talk to each other. When can she claim half of his and or see his Social Security income?
That's a very specific data point. They've been married less than 10 years.
Oh, I think it's greater than 10 years. That's a greater than 10 years.
Okay.
Yeah.
So they can never see his Social Security. Ironically, though, you can contact the SSA and ask what the divorced spouse benefit is, which is seeing his Social Security, without actually giving you the number for him. If you assume that half is what the divorced spouse would receive at full retirement age, that's his full retirement age benefit times 2. So you can get your number from the SSA, and it's something that doesn't happen automatically. You need to contact them, but it's not like there's even a question whether you'll get it or not, assuming that you qualify and it's greater than 10 years. The point worth noting here, though, is that it acts a lot like the spousal benefit in that, in fact, the payment is this exact same size, virtually anyway, based on your own retirement age, not your ex-partner's. But you have to have been divorced for 2 years and decouple if you don't want him to have gone first. So in a spousal benefit, the primary insured has to file first, and then the spouse gets to file. The divorced spouse benefit, the primary insured has to file first if they've been divorced less than 2 years. After that, it's decoupled, and you can file whenever you want.
All right, a Medicare question for Ari from Yasarfo. From Yasarfo 8055. I started my Medicare A and B at age 65. From age 67, I secured a job as an ex-part with medical insurance for the next 3 years. Can I cancel my Part B and continue at age 70 when my ex-part job is over, and will be paying more if I rejoin the Part B? Will I be paying more if I rejoin the Part B?
Yes, you can cancel your Part B It's Form 1763. Wouldn't want you to double pay for insurance. Just know that be sure your employer has 20 or more employees. Then when you're ready to retire at age 70, there won't be a late enrollment penalty to reactivate your Part B.
Okay. Kevin Norris has a follow-up for Ari. I'm currently working full-time and won't retire until December 31st. I don't want to start paying premiums for B until I start my Social Security in March, if possible. Can I wait until November 30th to apply?
If you're retiring December 31st, I would want to see your Medicare start January 1st so you have continuous coverage. I wouldn't be penny wise, pound foolish, because what will your coverage be from when you retire at the end of the year through March? The answer is Medicare. Medicare is designed to be your health insurance. And if you wait until March, you can do it because technically you have 8 months after you retire in order to activate your Medicare Part B. So you could wait if you wanted to, but then what would your insurance be in the alternative? You wouldn't be actively working anymore. So you might say COBRA, but COBRA is only designed to be secondary to Medicare. COBRA is also very expensive. So even if your employer is totally subsidizing your COBRA, you'd still want to activate your Medicare because COBRA is only secondary to Medicare.
All right, Jeff, emailed question from S. I guess we don't have the name. If we don't need Social Security for income, does it make sense to claim early so we can enjoy the money sooner instead of delaying for a higher benefit?
Yep. So S specifically didn't want his name mentioned. That's why it's just S. Yes, you can. And people do that. If you think about why people claim Social Security, and this is something I cover at great length in my course, Social Security Simplified. In fact, this is the key point of the course, is helping you make this decision. But people who are claiming Social Security do it for one of four reasons. The first is they want to get every last dollar they possibly can out of the system. They've contributed for 30, 40 years, and you know what? It's time. They're due. And so they do the math, they look at break even, they assume certain things about their health, they look at their family history, and they say, based on everything I know today, I'm going to claim at this age, and whatever that age is. It may be early if family history is not so good. It might be late if family history is really good. Other people say, you know what, I've got enough money and I really want to enjoy the energetic years of retirement. So I'm going to claim at 62 or 63 or 64, and I'm going to use that extra income to do things or to give to charities or to support my family or whatever the case may be. That's okay too. The third reason is you just need the money, and life's been hard. You don't have any other options. It's this or some really bad things happening. And the decision's pretty clear when you're in that situation. I will say that most books don't write about that option as a real option. They will ignore that option completely, but it is an option and it does get used. And for in some circumstances, it's the best choice. And the fourth is that you want to claim Social Security at a point in time because you need more money at that point in time. And maybe you want to delay till age 70 because you feel like you don't have your long-term care covered. And so you want to wait as long as you possibly can so you get the biggest payment. So yes, the answer is people do it. They do it all the time. They claim early, they improve their lifestyle, they have the funds to enjoy their life. And so it's an individual decision. It isn't really based on what any single person does because different people do different things.
All right, Ari. Lisa M is asking, if living overseas, would I be able to keep my Medicare and health insurance?
Yeah, if you're living abroad, there's no issue with continuing to pay for Medicare. The question would be, are you planning to come back to the US? If you do go back and forth, then it's worth it to continue to pay for Medicare. If you're not planning to come back anytime soon, then it might be worth thinking through whether you may want to terminate your Part B for now and whether the coverage you have abroad is creditable for the purpose of delaying Medicare.
Okay, and Brett Phillips wants to know in regards to Social Security, how does that work for applying for Social Security from overseas?
Well, you can apply for Social Security and live overseas. In fact, you can live overseas in most cases and never come back and get Social Security. There are a couple of caveats to that. The first is, depends on where you live, I suppose. There are countries where you just can't get Social Security, and it's because the payment system doesn't work there. Like if you decided for whatever reason that you wanted to retire in North Korea, it would be really hard, and there are probably some laws against it as well, to be frank. But by and large, you can retire anywhere you want, get your Social Security payment anywhere you want. If you're a non-U.S. citizen, you have to be back in the country for 1 month out of 6. And so if you're planning on claiming Social Security and you're going to travel abroad and you're going to come back, that's totally fine. If you are a non-U.S. citizen and you move, well, you need to get back in the country and be here for 30 days every 6 months.
All right.
Otherwise, your Social Security gets frozen and then subsequently gets reactivated when you come back.
Joe, may I just make a comment on a back and forth that's happening in the chat?
Yeah, of course.
Vinyl Earth Inc. made a great clarification, which is that Medicare Part A does cover skilled nursing facility, which is the type of care someone may need post-discharge from. You're still considered inpatient if you're receiving skilled nursing care at a skilled nursing facility. So yes, that would go to Medicare Part A, and that would be covered by Medicare would cover 80%, and then your additional coverage, either Medigap or Medicare Advantage, would cover the remainder. And of course, you'd have the most flexibility if you choose Medigap. And by the way, Medicare Advantage plans can be very stingy on skilled nursing facility care. So if this is something that you may need down the road, all the more reason to be thinking about Medigap in that case. I've seen Medicare Advantage plans kick people out after only a few days in a skilled nursing facility when they've broken over 20 bones and need to be there for weeks.
All right, good catch, Ari. Thank you for finding that. Terry is asking a Medicare question. If I claim Social Security before age 65, will Medicare premiums be taken out before I'm actually on Medicare? How are Medicare premiums calculated, and which income sources are included in the 2-year look back? Ari, that one's for you.
So I think the question, were they asking, they're not 65 yet, right? Is that what they're saying?
If I claim Social Security before age 65, will Medicare premiums be taken out before I'm actually on Medicare? And how are Medicare premiums calculated? And which income sources are included in the 2-year look back?
I actually have an exhaustive list in the book on in the teens. I think the page numbers are like, I want to say 11 to 13. So it's right near the outside of the book, and that has an exhaustive list of what income sources count for the purpose of calculating IRMAA. That said, if you haven't started Medicare yet, you don't have to worry about it. It'll only pertain to you once you start Medicare.
All right. Chicken Silky Sticks wants to know, what is full retirement age?
Chicken Silky Sticks. I love that. I love that. That's Chicken Silky Sticks. Yeah. I will always remember that one. Full retirement age is the age, it's the magic age in Social Security. I jokingly call it the magic age because it is when you can get 100% of the payment that they say is owed to you. You can actually get more than 100% if you continue to wait. But it also unlocks a couple of other things. The first is you can start working again and collect Social Security. Conversely, if you reach full retirement age and you've been drawing Social Security and you want to pause your Social Security payment and let it continue to grow, you can do that at full retirement age. You can do it for up to 3 years. So let's say between age 67 and 70. You can add another 24% onto the size of your payment approximately. It's also the age that the spousal benefit is based upon. The spouse can get up to 50% of the primary insured, the primary worker's Social Security benefit, and at the primary worker's full retirement age. And it's also the age the spouse can get the maximum spousal benefit at full retirement age. It's an important number, and it's one that is referenced a lot. But those are the biggies when it comes to what full retirement age is and how it's used.
All right. We are 4 minutes to the hour, so we're going to go quickly, speed round, and see how many more questions we can ask. Steve has a Medicare question. Are any Medicare Advantage Part C plans free for veterans?
There's 65% of Medicare Advantage plans have a $0 premium. You still owe your Part B premium to Uncle Sam, but the premium for the Medicare Advantage plan would be $0. And there are actually special plans for veterans called Medicare Advantage only plans, because your prescription coverage comes from the VA, and then you just get your hospital and medical benefits through the MA plan. That might be something to consider. Depends on where you live, depends on the doctors you see. There are all these variables we would need to account for. So let's see what might be available to you.
All right. Mike D is asking a Social Security question. If I start collecting Social Security at full retirement age, but the following year go back to work and pay more into Social Security while still collecting, will my Social Security be recalculated higher each year?
Yes. Yes. The SSA takes your best 35 years, averages it out in current dollars, and uses that as the basis for your Social Security payment. Or you could pause your Social Security payment at full retirement age while you're working, and then you'll get big increases. If you do it the first way, you'll get tiny increases. You're still talking about 1/35 of the payment. But one of the big benefits we talked about just a minute ago was at full retirement age, you can pause your Social Security and let it continue to grow. And if you're working, that's a pretty good reason to pause your Social Security.
All right. I believe this is a Medicare question for you, Ari. Fast Eddie's asking, my brother's on SSI and Medicare and gets food stamps. If I give him money like the $19,000 tax-free, would this hurt his benefits?
It's a pretty specific question.
Yes, let's take that offline. I'm not sure whether that would count or not.
Okay, so we'll take that one off.
Why don't you email that question into us at livestream@holyschmidt.com, and then we'll look into that for you.
And there's some other arrangements that might be worth considering here. For example, you might want to consider talking to an attorney about setting up a trust to help your sibling, because then that might shelter the gift that you're making, and then it wouldn't count for the purpose of receiving Medicaid. Depends on the state. Medicaid is state by state, even though it's a federal block program.
All right, Terry has a question, a Social Security question. Will Social Security still give credit if you're working past 70? Do you still get credit in your Social Security payment since you're still paying Social Security from your paycheck?
You do, but remember what I said just a couple of minutes ago. Every year that you add on, let's assume that you earn more at 71 than your average, and so you bring your average up, and therefore your payment goes up. It's still only 1/35 of the size of the payment. So it's not worth continuing to work if that's the sole reason you're continuing to work. If it's not, then it's just a nice benefit.
All right. Well, we are at the top of the hour. Do we want to stuff in one more question? We have Ari with us. Let's try for one more Medicare question from Robert. I'll be 64 in April 2026 and plan to keep working until at least age 65, perhaps longer. When do I notify Medicare I'm turning 65? I understand there's a penalty if one doesn't notify them. How does this work, especially if I work past age 65?
If you're still working and the employer has 20 or more employees, rule of 20, then there's nothing that you need to do. Now, it would be to your benefit to take Medicare Part A only, so long as you're not contributing to a health savings account.
All right, and Jeff, the other half of his question was for you. For Social Security, when do I notify them that I'm ready to start taking Social Security? How many months before the start date?
You can notify them as early as 4 months before, and I would not wait past 2 months before, because things are a little bit slow there in terms of staffing. And so you want to just make sure that you get in. You can do it all online. It shouldn't take long. The only reason it'll be a problem is if there's an unfortunate situation like dual earnings records from someone else using your Social Security number. We talked about that earlier. But I would say the sooner the better. You can wait. You can do it 4 months in advance if you want.
All right, great. So we're out of time. So I'm going to turn it back over to you, Jeff. But thank you so much for all the questions. Anything we didn't get to, we'll go into our email list and we'll bring them back to you next week.
Gang, thank you
Phenomenal
so much.
engagement.
And Ari, thanks again for joining us today. We are really fortunate to have Ari on with us to answer a lot of these more difficult these more difficult Medicare questions. And I call us the power team because Ari and I kind of work well together, and then Jill manages both of us to make sure that we stay on the straight and narrow. So Ari, thank you. Jill, thanks for your expert guidance through the hour. Gang, thanks for staying up late with us today. If you haven't done your tax return, now would be a good time. You've got about 36 hours before, not even 36 hours, you got about 28 hours left to get it in before things start to go a little bit south. And we will see you next Tuesday, and we'll have more of the same then. So thanks everybody for joining us, and we'll talk to you soon. Bye now.